Good morning, everyone, and welcome. Today, we're going to explore the critical issue of child abuse and neglect in low and middle income countries. Our focus will be on understanding the epidemiology, identifying risk factors, considering cultural contexts, and discussing effective public health interventions. This presentation aims to shed light on the challenges faced in protecting vulnerable children and to highlight strategies that can make a real difference. I'm looking forward to sharing these insights with you. Child abuse and neglect, or CAN, encompass various forms of harm including physical, emotional, and sexual abuse. Importantly, it also includes situations where children are not provided with the necessary care and protection they need to thrive. This is a critical issue worldwide, recognized as a major public health concern because it can have long-lasting effects on a child's development and well-being. When we focus on low and middle-income countries, the challenges become even more complex. These regions often face limited resources and weaker child protection systems, which makes it harder to prevent and address CAN. Additionally, cultural norms can play a significant role, sometimes influencing how abuse is perceived or whether it is recognized at all. Because of these unique circumstances, it's crucial to understand the specific contextual factors at play. Only by doing so can we develop effective strategies and interventions that truly safeguard children's rights and well-being in these settings. When we look at the epidemiology of child abuse in low and middle-income countries, one key issue is that the prevalence rates are often underreported. This happens because many cases go unreported, and the surveillance systems to track these issues are limited. Compared to high-income countries, there are significant gaps in data collection, which makes it difficult to get a clear picture of how widespread the problem really is. Despite these challenges, the evidence we do have shows that child abuse and neglect remain a serious public health concern across these regions. To address this effectively, it's crucial to improve local research efforts. This will help us develop intervention strategies that are specifically adapted to the unique circumstances and needs of each area. When we look at the risk factors for child abuse and neglect in low and middle-income countries, several key issues stand out. First, economic hardship and poverty place enormous stress on families and limit their ability to provide proper care for their children. This financial strain often creates a challenging environment for healthy child development. Social inequality also plays a significant role by increasing vulnerabilities and marginalization within communities. Additionally, family stressors such as parental substance abuse or mental health problems can greatly elevate the risk of abuse. Political instability and weak enforcement of child protection laws further compound these risks, making it harder to safeguard children effectively. Cultural practices and norms sometimes tolerate or even obscure abusive behaviors, which complicates prevention efforts. Lastly, insufficient social support systems mean fewer safety nets to protect children from harm, leaving many at greater risk of neglect and abuse. Understanding these factors is crucial for designing effective interventions. Adverse childhood experiences, or ACEs, refer to traumatic events like abuse and neglect that happen during childhood. These experiences can have serious and lasting effects well into adulthood. One of the most significant impacts is on mental health, increasing the likelihood of conditions such as depression, anxiety, and PTSD. But the effects don't stop there. ACEs also raise the risk for chronic physical illnesses, including heart disease. Beyond health, these experiences can disrupt a child's development, making it harder to succeed in school and form healthy social relationships. Perhaps most concerning is how trauma can continue across generations, as impaired parenting influenced by ACEs can pass on the cycle. Understanding these profound impacts underscores why early intervention and ongoing support are critical to helping these children thrive. When we talk about child abuse and neglect in low and middle-income countries, one of the biggest challenges we face is the significant gaps in knowledge. These gaps limit our understanding and make it very difficult to design effective interventions. To address this, we need culturally sensitive research methods that truly reflect the local contexts and practices. Without this, our data might not accurately represent the realities on the ground. Robust epidemiological data is essential because it allows us to quantify the burden and characteristics of child abuse and neglect more accurately. This kind of solid evidence provides a foundation for developing targeted and effective policies. Policymakers rely on evidence-based guidance to create child protection strategies that actually work in their specific contexts. Finally, building and enhancing research capacity in these regions is crucial for sustainable progress. By strengthening local expertise and resources, we can ensure ongoing efforts to reduce child abuse and neglect, ultimately leading to better outcomes for children and communities. When we look at the socioeconomic and cultural context, it's clear how deeply these factors influence child abuse reporting and intervention. Firstly, cultural beliefs can sometimes normalize certain disciplinary actions or overlook the impact of emotional abuse, which makes it harder to recognize and address abuse. Then, economic conditions play a significant role in shaping family dynamics and determining the resources available to support children and families. Additionally, the political environment affects how laws are enforced and how much attention is given to child welfare issues. Ultimately, understanding these cultural, economic, and political factors is crucial. It helps us create prevention and intervention programs that are not only effective but also culturally sensitive and respectful, ensuring they really work within each community. Child abuse and neglect are not just individual or family issues, they represent a critical public health priority that demands a comprehensive and multisectoral response. To effectively tackle this problem, we need to strengthen our surveillance systems, ensuring better detection and reporting so that no case goes unnoticed. Prevention programs also play a key role. These programs must target the underlying risk factors that contribute to abuse and neglect, addressing the root causes proactively. Most importantly, collaboration is essential. Governments, civil society, and international agencies must work together to reduce the prevalence and impact of child abuse and neglect, especially in low and middle-income countries. This united effort will significantly improve child health and development outcomes worldwide.